Hello everyone, this is Dr. Nikhil Agrawal. I am Director of GI Oncosurgery at Max Super Speciality Hospital, Saket in New Delhi. Today we are talking about colon cancer. While the cases of colon cancer have shown a decrease in the Western world, we in India have seen a progressive rise in the incidence of colon cancer. Diagnostic tests are tests which we do to find out the presence of disease, and staging tests are tests which we do to find out the extent of the disease. For colon cancer, the most reliable diagnostic test is colonoscopy. In this, we use a tube with a camera to view the inside of your colon, and if we detect any abnormality, we take a biopsy. Biopsy means sampling a small piece of your tumor and seeing it under the microscope, which is usually done by pathologists for the presence of cancer. For staging, we do a CT scan or a PET CT scan. In this, a scanner images the inside of your abdomen and chest with X-rays. These images are then computer processed and gives us an accurate representation of inside of your body. Chances of recovery from colon cancer depends on the stage at the time of the diagnosis. Lower the stage, better is the long-term outcome. Stay alert, stay healthy.